down there.
Yeah.
We're in, right?
Yeah.
Alison, welcome. How are you?
Oh, I'm really well, thank you. Thank you for having me. I'm excited about this.
Well, we are as well. We spoke at the fertility show for the first time.
That's right.
I was sat having my lunch, I think with Liberty, and you just ran past and said that you'd seen our stuff, and I was over the moon with that. I think
I wasn't there.
You were at home on the Sunday.
I was.
Yeah.
I couldn't come.
You couldn't come, but we were there. We were both there on the Saturday, and we were there for the whole weekend. But we managed to meet a lot of amazing people. You being one of them, and one of the first things I said to you was, "Can we do this conversation on a podcast? Because I think there's a lot of value to get out of this." So, firstly, thanks for accepting, and it's great to have you. And our first virtual one as well. This is a first for us. So yeah, thanks for having us.
Well, fingers crossed.
Thanks for being here.
Here's the technology working, right?
Well, so far it's working. We've been on 2 minutes. We're good.
We're good to
We're
go.
good to go. So yeah, let's jump straight in, Alison. I think what's best to do to start with is give the listeners a bit of context as to kind of who you are, what you do, and your story, your fertility journey story, if you like. You can start from as far back as you want.
Yeah, okay. So I've not always been, I'm a nutritionist and I specialise in fertility, and I've got a particular interest in miscarriage and recurrent loss. So that's where I am now, and I work with clients, I work with individuals who are looking to improve their chances of a successful pregnancy. The vast majority of clients come to me having been on a really long road. I mean, no one comes to me saying, "Oh, I fancy trying to have a baby. Let's just, try and optimize things." Sadly, I wouldn't have done that either. So that's what I do now, and I work with couples and individuals. I also lecture, so I teach the degree module in fertility nutrition and my other pet passion, which is the vaginal microbiome and the reproductive microbiome. So I do that at the Institute for Optimum Nutrition. I sit on an MDT at an IVF clinic, and I deliver CPD, so training for consultants and doctors. And that's sort of what I do now. But in a previous life, I was a television producer in London, burning the candle at both ends, having enormous fun, and burning myself out was the backstory, really. So I worked hard, I played harder, I think, and I loved it. I loved what I did. I felt really fulfilled by what I did, until we started trying to have a baby. And I got pregnant really quickly. And this has always been my story. I've not had a problem actually conceiving. It's the next bit that's always been the challenge for me. And that first pregnancy got to the 12-week scan, full of excitement. This was just wonderful. We were in this gorgeous little bubble. And then we got the silence, and we got the, "Can you come into another room, please?" And then what followed was literally about 10 weeks of ricocheting between consultants, where they thought something wasn't quite right, but they didn't think it was going to warrant a termination for medical reasons. "Oh no, but at the next scan, this doesn't look good. We need to get you in again." And it was literally back and forth and back and forth. And in the end, there was a late loss. So we lost our little boy at 22 weeks. And that was understandably, I mean, it rocked my world. Had to go back to work 3 days later.
3 days? Wow. What was it because of the demand of the employer, or was it you just wanting to go back into work? What was that decision?
No, I called in sick. Yeah, I called in sick. And because we'd had this sort of, this is a long time ago. I mean, I had my babies in the dark ages. My oldest is 19 now, and this was the pregnancy before that. So it's a very long time ago, right? This wasn't talked about. I didn't have any friends, although I was in my late 30s at that point. I did not have any friends who'd gone through any fertility issues that I was aware of. And so I'd been really superstitious about getting to the 12-week scan, and then I was going to just make my announcement. So apart from, close family and friends, I hadn't really mentioned anything to anyone, and I certainly hadn't mentioned anything to anyone at work. But then when we got to the 12-week scan and it was a sort of, don't know what's going on, I didn't really feel very comfortable talking about it too much. But I did eventually tell my boss, and he was quite sympathetic initially, but then there were just so many doctor's appointments and he kind of lost patience. So by sort of 8 weeks later, 2 months later, it was sort of, we weren't in a very good place. So I just had to go back to work. I mean, it was just the way it was. And I didn't really question it at the time, to be honest. And then what followed after that was lots and lots of rounds of medical consultations. I was sent to an oncologist because they thought there was something in that realm going on. I mean, it was a really, really dark time for about 8-9 months. And then I met a brilliant consultant who actually looked at things in a slightly more holistic way. And up until then, I'd had conversations with consultants, so they'd look at my notes and they go, well, Alison, nothing straightforward with you, was literally something that one of the consultants told me.
That's kind and helpful.
Really kind, really sort of, it gets you there, doesn't it? And then I met this consultant who was incredibly forward thinking, and he started talking about a more holistic approach. And the penny kind of dropped a little bit because I was knackered. I was living on very little sleep. I did have, I loved food, but I was, surviving on a lot of fast food, convenience food, because I was literally working all the hours that God sends. And then when I wasn't working, I was out having fun. And so what he said made a lot of sense. And suddenly I started viewing the food that I was eating as something a little bit more than just sustenance. And I started reading into it. And I got really, really kind of immersed in the fact that food is information for our cells. And once that realization had dropped, it sort of started me on my own round of sort of navigating this medical system that generally was just sort of saying no, can't help you all the time. So I was finding my own way through it, and thankfully I had this incredible consultant who was able to steer me along that path. I did then have another couple of losses. Then we had our little girl, who is now a 19-year-old late teen. Then I had another loss, and then I had 2 more girls. And then at that point, when I had my 3rd daughter, around the same time, my mum had been diagnosed with cancer, and we were told we weren't going to have very long left with her. So I decided I was going to stop work. And so I stopped work at that point to, because I was pregnant and I wanted to spend some time with my mum. And at that point, I started to look for something else I could do that I would be equally passionate about. And that's where nutrition really took on another world for me. And I enrolled in at the Institute for Optimum Nutrition, which is where I now lecture. I did a 4-year diploma degree course, and the rest is history. But actually, I never wanted to work in fertility. It didn't cross my mind to actually support people who were going through fertility issues, because it felt so loaded and it felt like the stakes were incredibly high. Having been through it myself, I just sort of felt I couldn't necessarily go there. And I've got so much respect for those people, and I know there are many of them who are actually going through the journey and helping people at the same time. I wouldn't have been able to do that. I wouldn't have been able to hold those boundaries, I don't think, because it was still really raw for me.
Well, Alison, thank you so much for being so detailed with your story, and what a journey you've been on. And I love the way you've turned, and we've met so many people like yourself, especially the fertility show and online, who've turned trauma or a difficult story a difficult journey they've been on, into helping others who are going through the same. That's kind of what you've done, right? You felt it firsthand. Yeah. And we will
to understand it, though, to be able to, I think, really delve into it, you need to have, I think, been through something yourself, so you can really empathise and understand.
Well, yeah, I mean, when we've done how many hours of discovery calls with people who've willingly came and talked to us to tell us about what they think's missing. And every time we speak to someone, on the phone, whether it's myself or Eleanor, she'll vouch as well. These people will open up about the most personal details of their sex life.
So open. You're like,
yeah,
I think people themselves want to help if it's going to help other people.
But they also feel cool. What I'm trying to say is they feel comfortable speaking to someone they just met online, because you've got that connection, you've got that understanding that people just get it.
Yeah.
So you get it from your journey, and it sounds, I'm really sorry for all the loss that you've had to endure. It's we had some early miscarriages, and it doesn't matter how many you've had, even one is absolutely horrendous. So my heart goes out to everyone who's had to experience that. But what I'm saying is, full circle, you've turned that into giving back, which is just a beautiful thing.
Yeah, it is. I mean, having been a television producer, which, it had a purpose. I'm not going to say it didn't have a purpose, it did. But then being able to actually, really connect with people, support them through it, guide them through it. And also very often, I mean, very much part of what I do now is, yes, it's about the nutrition, it's about the lifestyle interventions. And we know we've got really, really good evidence to support that. But it's also about slotting that in with primary healthcare as well. And I'm really, really clear with every single person when I first meet them, I'm not a doctor. I am a complementary practitioner. I work alongside primary healthcare. So I've got a number of consultants who refer to me. I've got a number of consultants I refer my clients on to, should I need to. But it's about that joined up thinking. And that's something I think that is really missing, unfortunately, for so many people who are going through this. They don't have anyone who's really joining the dots and looking at all the different parts and facets of their life. They might be just looking and focusing, which we always see, on the female in the first instance. And then we only start to have conversations with the male partner sort of 6 months, 12 months, even further down the line, which is just nuts. But we've got to bring all these strings together. And that's where this can be really, really valuable.
So do you think that fragmentation is throughout the whole fertility space? Like you're saying, a lot of people will focus on just the female, or they'll just look at diet and forget about everything else, or they'll just stop drinking alcohol, which is kind of part of diet, but they'll kind of do one thing, and like you said, they're not pulling, joining the dots together. I don't even think the clinics where people are paying good money or going through the NHS to do these rounds of IVF are doing any of this. Because we didn't, from our experience, and obviously that's our anecdotal experience, you can speak for it, we didn't have any of our clinics kind of, apart from the last experience with our clinic in Epsom, who were brilliant, and they really delved in. I mean, I'll let you tell Alison a little bit about our experience.
I would also say the CRP clinic as well, they were good.
Yeah, but explain a little bit about your experience, because I'm doing all the talking.
What, like our first clinic experience?
What your experience is in terms of what Alison's talking about there, about how things aren't a kind of, you drill down on one thing, but they're not actually looking at like such a multifaceted situation.
What you mean, there's different areas to focus in on to see, are you optimizing your chances, basically? And I think when we sort of went into our first round, I didn't know anything. I think all I knew was 3 months before, stop smoking, sort of get your diet together. But I personally think you need longer than 3 months. I think you should be looking at things before that. But there was just a few basic things which I knew. It wasn't until it was after we'd had 2 losses, and I just knew something wasn't adding up. It's like, there's things which aren't quite right, and other areas that we need to explore. That I found out I had PCOS and I had an immunity problem, and that they're like quite even basic things which you can look at, and things like nutrition, big time, which you can really it needs to be individualized, because everybody is so different, and you might be lacking in certain vitamins. And I actually did speak with one of our friends, is a nutritionist, Roe Huntress. And
dietitian. I said nutritionist last time, and she went, I'm not a nutritionist, actually, I'm a dietitian. There's a difference.
Yes. But she, really helped me drill down on my supplements. I was maybe taking too much of one thing and not enough of something else. And I do think it depends which clinic you end up with, and I think it's sort of very much luck of the draw. But I didn't, our first clinic that we were with, I won't name who it was, but there was just no sort of real pre-prep. It was, well, this is what we're doing. And then when we had our first loss, it was straight into, so when do you want to do your next round? There wasn't an investigation as into what might have been going wrong. And when we'd had that second loss, that's when we decided to have a pause, moved away from them, and we actually went to a specialist reoccurring miscarriage clinic in Epsom. And they were the people who did the huge blood panel on me. Like I had about 10 or more vials of blood.
I remember the blood you gave that first day. Yeah, it was crazy.
And all the different tests they were doing. And that's, I think, just from the doctor asking me even just a few questions. This was after my blood had been taken. He wanted to just ask me a few questions, and he said, would you mind if I did an internal scan on you? I think that you might have PCOS. And I mean, I'd had so many scans at our first clinic, and never once was that looked at. And as soon as he was starting to do the internal scan, he said, oh, look, there we go. You've got, said it looks like a pearl necklace on both of your ovaries. And I just thought, if it was so easy for you to find that out, why did our clinic, who we went privately with, why did they not pull that up? And, you know, that meant me changing my diet, changing how I exercise. I used to really go in on high intense cardio. I loved it, and I loved getting really sweaty and out of breath. And it turned out that was not the right exercise for me to be doing for it's not called PCOS anymore, is
PMOS.
it? PMOS.
Yeah. PMOS, which is brilliant. I did a webinar on this last night. And actually PMOS is a really good example of this. First of all, I think it's really important to make it clear that in the vast majority of cases, fertility and subfertility, because I don't call it infertility, because generally there is something you can do about it.
Yeah.
And that's one of my real bugbears. We haven't looked hard enough.
That's it.
Okay, I like that.
That is it.
And generally, fertility is multifactorial. It's not going to be down to just one thing. Diet is really important. It can help optimize so many things. When I see a client, I'm going to take a really detailed intake blood panel. I'm going to look at the microbiome. I'm going to check not only a semen analysis, but a DNA frag, assuming the people in front of me have got the means to do it, because obviously some of this stuff is expensive. And if not, we have to work out how we can get around some of these things. What are the lowest hanging fruit? What are the biggest risk factors, if you like? And we go after them. And the reason PMOS is such a perfect example of this, it used to, that when the name was PCOS, all the focus was on these polycystic ovaries. And they're not even cysts anyway, but that's another matter. But
I didn't know that. I didn't know that. I thought that's what it was.
Follicles. Oh. No, they're follicles. Yeah, so there are lots of, what should be happening in the menstrual cycle is you get one dominant follicle where an egg's recruited, and that follicle then matures the egg, which is then going to ovulate, you know, around that time of ovulation, and then that will hopefully go on to be a successful pregnancy. What happens in PMOS is you've got lots and lots of follicles that are vying for that place, which happens anyway, but none of them become that dominant follicle.
Okay.
Which is why we see AMH levels as well, because AMH, the anti-Müllerian hormone, is made in the granulosa cells that are inside these follicles. So, you know, and so if you've got more follicles, you're going to have a higher AMH.
I have a higher AMH.
Example.
Well, yeah, that's the thing. Well, in our first clinic, they said, oh, you've got a high AMH, so you'll be fine. It's all great. That was kind of it. There was never any discussion. You know, the fact that we had two, a fresh and a frozen cycle and 2 losses, and still PMOS, PCOS at the time was never mentioned. We'll come back to what you said before about it being a multifaceted thing. There's so many different data points you can take from to try and find out, like you say, what the problem is. And I just don't think, I actually think that the system, I don't know what your thoughts are on this, Alison, but I feel like the system, the clinic system in general, I'm not, you know, talking about specific clinics, but I feel like there's a lack of, like you say, I think you put it perfectly, join the dots in general. I don't know what your thoughts are on how that could potentially be put in place. Like, how could clinics do this? Like, what could they do differently?
Well, I think there are lots of things that can be done differently. I think the difficulty is when you've got these sausage factories almost, and nobody is looked at individually. And we are all individual. We're all going to have different, when a client comes and talks to me, for example, I get them to do a really in-depth questionnaire, like, pages and pages. It's only check boxes. It doesn't take too long. But I want to know family history, medical history. I want to know current symptoms. If someone, for example, tells me that they suffer with hay fever really badly, I'm immediately thinking histamine. What's the role of histamine in fertility outcomes? Could that be part of that recurrent loss picture because of the way the immune system functions?
Yeah.
For example, I want to know, what's been going on in the past. I want to know what's happened with, first degree relatives. I want to know about any medications they're on, any supplements that they're on, because very often people come to me because they've been wanting to do everything right and they are rattling in supplements.
Yeah.
And of course they are.
Yeah, we did that. We did it.
Yes, of course you are. But what's right for that person on that podcast or who wrote that blog is not necessarily going to be right for you. And we need to very often just sort of pull back from all of that, because just think about the burden that places on your detoxification system. We talk about things like, smoking and recreational drugs and alcohol use and all of that stuff and ultra processed foods. But if you are literally rattling with these things, then there could be a problem, because actually that is placing a huge burden on your liver, on your kidneys. And a lot of that stuff you don't need. It's actually creating more noise, if you like.
Yeah. When you said before, I forgot to mention it, because you were obviously telling your story in a lot of detail. You said you took a holistic path. Just for people who don't know potentially what holistic is, could you just explain a little bit more about what you mean by in a holistic route as opposed to a traditional or medical route?
Yeah, so if we think about that medical framework, we are going after, and the NHS is really well set up to address acute care and acute issues. If there is, and the NHS is designed to identify a diseased state and make you feel better, okay? But that's not thinking about all of those other factors that could be contributing. So the approach that I take, which lots of medical professionals do not necessarily agree with, but a vast majority, or no, a vast number, I should say, of primary healthcare providers are now becoming really interested in what's called functional medicine. And functional medicine is, in functional medicine, what we do is we acknowledge the body is a series of interconnected systems, and one system may have a knock-on effect on the next system. So if we think about, for example, fertility outcomes, say somebody comes to me and they've got IBS, they've got a dodgy tummy, they might have constipation, they might have diarrhea, lots of bloating, gas, whatever. That is going to potentially have an impact on, for example, the way they absorb their nutrients. That might have an impact on the way their body is going to detoxify estrogen and other toxins, which could lead to hormonal imbalance, for example. That could have an impact on the gut microbiome, which has a very, very clear and direct relationship with the reproductive microbiomes, which we now understand can play a really big role in fertility outcomes. And if we look at infections, up to 15% of early losses and up to 66% of late losses are because of an infection of some type or another.
Well, that's a huge number. I didn't know it was that high.
Enormous number.
Wow.
Yeah, absolutely. We know that the vast majority of losses, about 80%, occur in that first trimester. And of those losses, most of them are due to chromosomal abnormalities. All right, so we need to be very clear. We know that it's about 50 to 60% of sporadic miscarriages, and it's about 40% of recurrent miscarriages. But that leaves quite a big area where other stuff is going on. Now, if we're thinking about chromosomal abnormalities, you're thinking about egg health, you're thinking about sperm health, for example, and we're thinking about all those nutrients that can support egg health and sperm health, antioxidants. We're thinking about good lifestyle to support those conditions. But then there are other things going on. The thyroid, if you've got somebody who's got a suboptimal thyroid function, that's really important to rectify before you become pregnant, because the fetal thyroid gland does not become mature enough to support that pregnancy until about week 16. So until then, that little one is entirely reliant on your thyroid output. And if you're not producing enough thyroid hormones, that can result in loss, for example. But it's about this joined up system rather than, just taking something at face value. Or what I see very often now, particularly in those clients of mine who are over 35, and I tend to attract people who are over 35 because I'm so far over 35, and I really have a problem with the whole age conversation around fertility. But very often people will just look at a woman's age and say, oh, well, that's the issue.
Yeah, we see it all the time when we've been speaking to people. They just write them off.
Yeah,
and that's also prevalent in the NHS kind of postcode lottery thing.
It is, because that's what happened to us.
That's exactly what happened to us. Eleanor, how old were you?
35.
And you were just basically...
We were eligible for nothing.
0 rounds. And
old.
Yeah, written off. It was 35, wasn't it?
I was 35, yeah.
If we lived in a different place, like for example, if you lived where I'm from.
Oh no, maybe I was a bit younger.
No, I think you were 30. It was.
No, by the time we were looking to start IVF, I was 35, and they said, yeah, no.
But I know in the northeast, the age range is much higher, and you get up to 3 rounds. So if we'd lived where I'm originally from, it would have been a different story. So it is purely a postcode lottery. So yeah, sorry, back to your conversation about the age. The writing women off at 35 is...
It's not fair.
It's just really not fair.
I mean, let's think about it. Realistically, how many couples can afford to start a family in their 20s nowadays? We can't.
Now.
No.
You might not meet your right person, so that might take a wee while. You might have a job and you're on that career path, and you, as I was just loving life, quite frankly. It didn't even cross my mind. Yeah, I was working hard as well, I might add, but yeah. But then, so there are all these other things that are going on, and certainly, so many people aren't even thinking about it until their mid to late 30s. And then suddenly they're hit with this brick wall. It's a little bit like BMI as well, and larger bodied persons. And, the assumption is immediately that if you have that higher BMI, you are unhealthy. Well, let's do the metabolic checks first of all, because actually you might be okay. We need to do due diligence, and that's the thing, and due diligence is not being done at the moment.
Yeah. You mentioned microbiome as well. This is
fascinated.
Yeah, seminal and vaginal microbiomes, which I don't know how many people have heard of this. Yeah, I don't know how many people have heard of this, but I certainly haven't, or don't, or know very little about it. So could you explain it to us like we're like 12 or something? Okay, yeah, great.
One of my clients test their microbiomes when they come and work with me. It's that important, and it's growing in recognition now as well, which is brilliant. I've been running these tests since 2019, but now it's becoming more commonplace. So we know about the gut microbiome. A lot of people have heard of the gut microbiome. We have trillions of bacteria inside of us. A lot of them live in the large intestine, and they help do stuff like digest our food, and they can help, they create certain nutrients, and they do all sorts of things. They can support hormone balance, cholesterol levels. Some of these bacteria interact with our neurotransmitters, so can impact our mood, for example. The gut isn't the only place that have these microorganisms. We have them all over our body, on our skin, in our mouth, in our lungs, and in our reproductive tracts. And what we understand from a female perspective, We know that there are certain bacteria resident, if you like, in the vaginal tract and in the uterine environment, and in fact in the fallopian tubes, around the ovaries as well. Some of these bacteria are really supportive and protective for fertility outcomes. We want lots of them. They're called lactobacilli, and there are actually a number of different types of lactobacilli. And in fact, two of them are particularly good because they produce high levels of acid, which wards off more pathogenic bacteria. So that's how they work, roughly. There are also all sorts of bacteria that can cause serious harm to fertility outcomes, resulting in implantation failure, first trimester loss, and as I mentioned earlier, an awful lot of second and third trimester losses have infection at least implicated, even if it's not the main driver. We can test them, and when we know what's there, we can take steps to put it right. And that's the important bit, because you should never ever be offered a test or run a test if we don't know what our pathway is going to be afterwards. We need to be able to action those results in an evidence-based way, which is really, really crucial. But we can do that. And if somebody, for example, has a history of thrush, bacterial vaginosis, recurrent UTIs, I'm immediately thinking that is a microbiome issue. All of those issues are microbiome issues.
Is that Candida?
Candida is a type, yes, it's
Okay.
a fungal yeast.
Yeah.
So that comes under thrush banner, absolutely.
Okay.
What's really interesting is a lot of women think I've got thrush, and actually it's bacterial vaginosis, which is caused by bacteria rather than yeasts. So again, what we need to do is have good testing in place so we can decipher the two and actually differentiate between them, because otherwise you're giving yourself a yeast treatment. Well, that's not going to work on a bacteria.
Right. So
And that's
when you go in to fix the microbiome, sorry to cut you off there, Alison, a bit of delay.
No.
Obviously, when you think about gut microbiome, which we've been speaking about for years, we kind of know what the go-to is for that. But how do you fix vaginal or seminal microbiomes? How
do you?
Yeah, good
Say that. What do you do?
Yeah. What's the process? Is it easy or is it quite difficult?
It depends. And I think with everything in nutrition, nothing is going to be a sort of, a magic wand, silver bullet, and next day everything's fine again. It's not in modern medicine either, to be honest. We're looking to see what the pathogens are, what bacteria are present. And it might not even be that there is a really pathogenic bacteria, but it might be an absence of the beneficial species that is still going to cause issues for us. So we look and see what the issue is first of all. The first thing I want to see is a high level of these lactobacilli species, and I want specific types of lactobacillus in there as well, because some of them, they can go to the dark side. They can be a bit like that friend of yours who goes out on a night out, has too many to drink, and becomes a total nightmare and causes trouble. All right. They're great when they're sober, but they're not so great the rest of the time. So there is one bacteria in particular, one lactobacilli, that, we've got to be a little bit more careful of, can be a bit sketchy. But then what we want to see is, once we know how many of these lactobacilli communities we've got, then what we're looking to see is what else is there. In some cases, we might need antibiotics, in which case I'm going to refer my clients to either back to their GP or their consultant in the first instance, because I'm always going to be talking to their consultants and keeping them in the picture. And if not, I work alongside a number of prescribing pharmacists, so I can make those referrals myself. But antibiotics alone are not going to be enough. So as well as the vaginal and uterine microbiome, we've got the seminal microbiome. We know a lot less about that. But if, again, there are pathogenic bacteria in that seminal microbiome or in the vaginal microbiome, if you're having an intimate relationship, you're sharing a lot more than just bodily fluids. And therefore, there are going to be some of these bacteria that pass back and forth. The reason I mention this now is because what I'm often seeing is people are given a nice dose of antibiotics, but antibiotics on their own are not going to do the job. So antibiotics go in and they indiscriminately kill, if you like.
Yeah.
They're going to get you. That's brilliant, and they can be incredibly effective by doing that and in that action. But actually, what we need to do, I often use the analogy of a garden or a flower bed. If I go in and I take out all the weeds and I've got nothing left, there is room for more weeds to potentially come and grow. What we want to do at that point is we need to introduce or repopulate the more beneficial strains of bacteria. And by doing that, we're going to create protection against those more pathogenic strains popping their heads up again, if you like.
Yeah.
So it's got to be this sort of, you can't just take the antibiotics and hope for the best. And then again, there are certain probiotics that work better with different bacteria. So, you can drill down into quite a lot of detail should you want to.
It's so complex, all of it. Just hearing that.
But it's just brilliant though, because actually we get answers to questions that haven't been able to be answered for so many years. And what's lovely is I can now have really sensible conversations with so many consultants and doctors because it is becoming far more widely acknowledged.
Yeah, that's great.
But it makes complete, that doesn't even sound holistic to me. That just sounds like common sense.
Yeah. It is. But when you're in the trenches and you're going through it, and you've got someone in a white coat telling you that this is what you should do and this is the protocol.
Okay, yeah, no, fair enough.
Sometimes we did it until as I always say this on these podcasts or on social media when I'm talking about our journey. But I always take my hat off to you because you were the one who was the driving force going down all these rabbit holes to find out what was going on. Even with diet, with us, with me. My DNA fragmentation, that was you. Stop eating this, drink that, saunas, all these things all came from your investigation. And there's so much. You were saying it's so complex. We're just talking about one thing, microbiome. There's so many other things and factors to take into consideration when it comes to fertility. So it is such a minefield.
Yeah.
But yeah.
It's a bit like when you PCOS earlier, and I think the new name of PCOS is really interesting because it's acknowledging now that it's not just about the ovaries. It's a metabolic condition, and we know that there are actually 4 different types of PCOS. So there is the type that's actually looking at insulin resistance. So you've got blood sugar, you've got an inflammatory source and driver of PCOS, you've got an adrenal source, so a sort of stress picture. And then you've got people who develop PCOS or PMOS after being on the pill, a sort of post-pill PCOS. If we can, just using that as an example, because there are only 4 types that we know of at the moment, you identify what is your driver, what's the root cause almost, then you can go after it in a really specific way.
Yeah, I just got told this is what you have, and then again, more investigation from me, and I found this lady on Instagram, and I ended up paying for sort of like a course really, and it came with all of the recipes and everything, so I completely changed how I was eating, and that I know like really helped me.
And it rubbed off on me as well.
It did, because you were doing the same. You were doing the same diet as me, but my immunity thing is interesting because there are still quite a lot of clinics and doctors, I suppose, who look at the treatment that I had for it as controversial. And because I've got really high levels of natural killer cells, so I had a lot of intralipid intravenous when we were doing treatment before we did our 3rd round of IVF. I did 4 rounds of superovulation, so with letrozole, and I had quite a few rounds of the intralipids, and I did as well the clinic that we used for our 3rd round. The doctors there were also huge about natural killer cell treatment, which was great because I'd done quite a lot of research myself, and I do think that was one of the things that helped us have our success the 3rd time out.
Well, the difference about those guys was, as soon as you walked in, it was like investigation, boom, straight away.
First conversation.
Nothing else. It was like, we're gonna, these are all the options. This is what's available to you. Based on, we're gonna do some bloods, we'll do some whatever. Then we're gonna make an educated guess on which ones are the best ones to do. We never had that anywhere else before, really, apart from the CRP clinic, which did do that. But in terms of an IVF clinic, we never had that before. So I don't know how
it was very individual. I felt, and my protocol was very personalised. Like I felt like the first two were sort of guesswork almost, and you know that I'm the first lot of medication I have, I wasn't it wasn't stimulating my follicles enough, and it just none of it felt right. None of it felt right, which is why we left. And yeah, we knew with our last clinic, like they were doing all the right things, and you know I'd obviously done a lot of my own homework, but yeah, I just wish there was and there are obviously more people now who are helping people with the investigation side of things, but that's something that was come up a lot in our discovery calls that we've been doing for Illuma, is that people want more education and they feel like they've gone through unnecessary wasted time because they didn't have the right tools and information given to them.
Yeah, that converts, that time converts to, like with us, it wasn't just the time, it was the money, and it was because we didn't get any free rounds, and it was the heartbreak and the loss, and you had to go through several rounds. I don't know, we're going on a massive weave here. I don't know how we got into this, but I think it was, you know, we'll come back full circle to what we're talking about, which was kind of this. We're talking about the microbiome, weren't we, and the kind of things you can do to
how complex it all is.
How complex the whole thing is, and no wonder people don't go down. You know, luckily we have got people like you on social media now talking about this,
telling people about
this. We didn't really find anyone. We had Ro, who was our friend, Ro Huntress, but apart from that, we didn't really see anyone like what you're doing on social media.
But if you're not everybody is that way inclined to be maybe curious and inquisitive or know where to go. I just, you know, I just sort of was doing.
You were very proactive.
Yeah. And, you know, for some people, if they haven't been successful, they might just think, oh, well, that's just our journey and that's that. And it's not meant to be, or they just.
I think this is where the education piece is so important because, look, in an age of AI, there is an awful lot of education out there and information out there. And in many ways, we are being blinded by it and overwhelmed by it. What I think is important, and the reason that I really, really like talking about this stuff, is because if somebody is listening to this conversation, for example, and thinks, oh, I get lots of BV, no one's mentioned that, but they wouldn't know to mention it if you don't mention it either. So it's sort of true. In your world, we're getting a really, really detailed intake questionnaire when you go to the GP. You know, a GP's got 7 minutes, for goodness sake. How on earth are they supposed to cover all this ground? And I do think we place realistic expectations on our GPs as well, because they've got to be experts in absolutely everything. This is new science. And therefore, if the conversation can be out there and people can say, in that first appointment, I've got really irregular periods, or I suffer with thrush, or I've got really bad gut issues, or my hay fever is terrible, or whatever it might be, then at least you're dropping some crumbs that people can then follow a little bit. And yet in an ideal world, all those questions would be asked. But then when I went through this, there wasn't even any bloody social media. It didn't exist.
Oh, of course. Yeah.
It wasn't there. So you just sort of had to, you kind of have to work your way through it. But also it can be when you're on this journey and when you're in the trenches at a time when, let's be honest, it feels like such a cruel twist of fate, that we go through fertility issues at a time when all of our peers are going through them, because it happens at a certain life stage. So you're having to deal with on whether the baby announcements, the expectation from family and friends, you know, at Christmases and when you come back from a holiday, or when's the big announcement going to be, you know, you've got to deal with all of that. You've got to deal with the hurt, the heartbreak of months, sometimes years of subfertility, of maybe not getting that positive pregnancy test or suffering loss after loss. And in each of those cases, it's the trauma that goes with that cannot be underestimated. And it's not surprising that people want to just sort of hide under a rock, quite frankly. It's a lot.
It is. Yeah, that's kind of how we felt as well. In fact, I'm going to put a question on you. What do you want people who are going through loss now, who are potentially listening to this conversation, to hear? What do you want? What do you want to? If someone's listening now who is going through exactly what you're speaking about, what would you like to tell them?
Okay, first of all, I'd like to acknowledge how shitty it is, because it is that one of the hardest things you're ever going to go through. It really is. And I genuinely believe that every pregnancy changes us. We know we've got this lovely, there's a concept now called microchimerism, which shows us that we actually carry the cells of every pregnancy with us through life.
I've heard this.
Yeah, we carry all of our pregnancies with us. And those tissues, those cells have been found up to 27 years later.
Oh, wow.
And every pregnancy changes us as well. And it's okay to have really ugly feelings. It's okay to feel mad at the world and hate everyone. And that's normal. And that is a result of everything that you've been through. So that, I think, is a really important acknowledgement, first of all. And I don't think it's acknowledged enough. In terms of what you can do next, it's about asking the questions, and do not, allow yourself to just sort of, be, what's the word? You can't be fobbed off with just try again. It's a numbers game.
Hate that.
The worst thing.
Just keep trying.
The worst, single worst thing you can hear is that. And we've heard it ourselves.
Or relax.
First.
Relax. Go on holiday.
Yeah.
Hey,
Have a drink.
go on
Just
holiday.
chill out.
Yeah. Yeah, horrendous.
So you've got to ask the questions. You've got to ask the questions, and you've got to keep pushing. And unfortunately, you've got to learn to be your own advocate. And that's really, really freaking hard. In fact, when you're in the trenches and when you're really feeling hurt and lonely and angry and you've got no energy to do anything, and it's hard, and you're trying to put on this brave face the whole time.
Yeah.
But there are things, what we want to try and understand is, could there be any common factors here? What else is going on with you? And if it is a chromosomal abnormality, for example, then we need to be thinking about egg health. We need to be thinking about sperm health. We can't test eggs. Science isn't there yet. We can test ovarian function, which is really useful, but we can test sperm. We can look inside the head of those sperms. We can look at the DNA. We can see how broken or fragmented those DNA strands are. And when we know that, then we can ask the questions, why? In this particular individual's case, why is that like that? And what do we need to do, therefore, to make it better? But we need to have, you need to have a little bit of knowledge to be able to do that, unfortunately.
Yeah.
It's like the chicken and the egg.
It is the chicken and the egg. But like you said before, at least now we do have social media, we have the internet. Unfortunately, it can be very overwhelming, and sometimes it can be information overload and people don't know what to believe. One person says one thing and the next scroll, it's the opposite, they contradict each other. So
that's really difficult.
It is. And I think I see more and more of that now. I think sometimes people are just trying to be controversial and trying to get clicks and views on one side, and you've got other people really trying to help people. And I think this is in every industry. You always have people just trying to clickbait and get views. But not you. And we really love what...
You've got to be really careful to differentiate. Sorry, go on.
No, I was just going to say, but not you and what you're doing, because we've spoke about, we love your content, we love what you're doing. And we think it's really important, especially I wanted to, you just mentioned men there. I was going to touch on it before, but the male conversation, I still don't think it's talked about enough. Obviously, with what we do with Illuma, we're trying to help people from an emotional standpoint feel like they're not alone and not isolated. But when it comes to the nutrition, diet, the medical side, all those sort of things, I still don't think there's enough conversation around the male factor than there should be. It's definitely better.
It doesn't happen soon enough.
No, yeah, exactly. To the point where, the clinic didn't even address me in the appointments, and we've heard it time and time again.
Yeah.
They'd be talking to Eleanor about me. in the appointment about like the sperm health or whatever, or the DNA frag, and it's like they're looking at Eleanor, and yeah, it's crazy how that conversation just isn't as
Doesn't seem as important.
it doesn't
And I don't
seem as
know
important.
why.
Yeah, I don't know why. What's
The
your view on
irony of
this?
that is that actually, yeah, the real irony of that is actually, in many ways, male factor, by virtue of the process of spermatogenesis, that production of sperm, an entirely new batch of sperm are produced every 74 days,
Yeah, yeah,
give or take, right? So there is a real window of opportunity here to change things.
yeah.
You know, for Eleanor and I, we are born with all of our eggs. You know, in fact, they were there when your grandmother was carrying your mother. You were there in egg form by the end of that second trimester.
That's crazy.
And then they go into this state of,
Crazy.
isn't it nuts?
Yeah.
Isn't it nuts? But that means that, yes, there's this maturation process for the eggs, which is that roughly that 3 to 4 months prior to ovulation. We can make huge changes then, and there is a real, there is this window of opportunity. But when it comes to sperm, we can create entirely new sperm. That's brilliant,
Yeah.
actually. So if we know that there's male factor, I'm always sort of like, yes,
Yeah.
brilliant. I know I
You
can
know
do
what we're working
we can
with.
do that. Actually. Yeah, we know exactly what we're working with then.
What do you wish male
And there are
part?
some
Sorry, Alison. Go on. Finish your thought.
No, I was going to say there are some incredible urologists out there who are really doing amazing, amazing work. And it's about, again, it's about getting that conversation out there and getting the word out.
Yeah. What I was going to say was, what do you wish male partners knew about their sperm health or their fertility health that a lot of people, or a lot of men won't? Or maybe, like you said, they find out too late. It could be a year or 2 years or 3 years. What do you wish men knew at the start about their fertility health?
That they have everything that man is exposed to in those 74 days is going to play into the quality of the sperm. And sperm respond really well to nutrition and lifestyle interventions. So for nutrition, let's think about fruit and vegetables, acar, vitamins, antioxidants. All right. It's like you want to have the right raw ingredients to bake the cake. You wouldn't bake a cake without eggs. You need to have your folate in there. You need to have all these antioxidants, and it doesn't need to be difficult. We know that a Mediterranean style diet is that's the best. Oh God, excuse me. Sorry,
Sorry.
I thought that phone was off.
Do you work?
I thought he was.
Oh,
Good for
sorry about that.
It's good for anti-inflammatory, isn't it? The Mediterranean diet.
It's a lovely inflammatory diet. It's got a lot of focus on plants, which are going to be rich in these antioxidants, these vitamins and minerals. And you don't need to be perfect. And I think that's really important as well. I take we don't live in we don't live in a perfect world. If we can do a sort of 80% of the time being on message, 20% of the time we're just chilling a little bit more, that's okay. And what we can do is we can start making some really smart choices so that, I'll be honest, a glass of wine here or there is not going to be the thing or the reason why you're not trying to conceive.
Yeah.
But let's do it sensibly. Let's have it with a nice meal, for example. Let's not have it on an empty stomach. Look, don't drink on consecutive nights. Have no more than ideally 2 units if you possibly can. But if it's your auntie's or your best friend's wedding, go and enjoy the bloody wedding for the love of God.
Yeah. You've got to live your life. You've got to live your life.
Exactly. But it's about those little hacks. It's sort of, don't drink on an empty stomach. That's a simple one. It's the little things. Make sure you're having protein at every single meal. Can you every single day, get some dark leafy greens in your diet? Berries, they're low sugar, they're high in antioxidants, they're high in fibre. Maybe you can just have some berries every day or every other day. Whichever one you want, doesn't matter. Just the little things are going to move the needle. And
Stay
I think
hydrated.
That's where people... Stay hydrated,
Yeah. Little things. Yeah. Well, these are all things that I've picked up thanks to you over the 4 or 5 years.
Dramatically improved your DNA frag by changing what you were eating. Things like no more saunas, no more tight, no tight boxes,
Cut out alcohol.
cut out alcohol. Just like the small things, but they all add up, don't they?
Compound,
They all compound.
Yeah.
Yeah, no, I was just saying sleep's a really big one for both, for both members of the couple.
Huge.
Yeah.
It's I'd say it's like the number one is making sure you have good quality sleep.
Yeah.
It's
Huge,
important.
huge.
You're not having sleep. You're feeling really shitty the next day. You make bad food choices because you need the energy. You need to put yourself up, or you're mainlining on coffee or whatever you're doing, and then it becomes this vicious circle. So it's trying to get back to the basics. And if that's a difficult thing for you, think about what you're doing around bedtime. Maybe there are some nice little. It might be for some people a chamomile tea in the evening is really good.
Yeah.
For some people, a magnesium supplement might help. For some people, it might just be having a shower before bed. Find your thing.
Yeah, love that.
I've got no more questions. You actually answered about 5 of my questions without you having even asked them, so that was brilliant. Have you got anything else that we haven't gone or covered?
No, I feel like we have covered everything beautifully. I was really interested to hear about the microbiome.
Yeah, me too. Yeah, because I didn't, until this conversation, until you've just explained it, I had no idea about that. So it's important that we start talking about these things that potentially people have no idea about. And there's probably still, like me, I'm kind of in this world, if you like, just from our experience and working with Illuma. There's still things I don't know. So
I love finding out new information.
Absolutely. Well, Alison, is there anything else you'd like to mention or say before we wrap up? We're coming to the end now.
No, I don't. One thing I will say is just a massive thank you to you two, because having that couple conversation out there and for people to see people go through it, be in the trenches, talk about it, acknowledge it, be honest. If it can make just a few people feel a little bit less alone on this journey, and then you're sort of, you're communicating the facts as well, that is just such valuable stuff. And don't underestimate the work you're doing, because it's huge, really.
Thank you.
Thank you, Alison. What we're actually trying to do is help people like you when you were in the trenches, or like us when we were in the trenches. Make people, it is as simple as that. Like, we don't think people should have to do this alone.
No.
Our tagline is together is always better, and it really is. And if we could have had something like what we're trying to build when we were 2-3 years in, a couple of losses, just
not knowing where to turn,
no answers, nowhere to turn, didn't know who to speak to, and I'm sure you felt the same when you were going through what you were going through. If we can help even a few people, then we're winning. And just to come back to yourself, Alison, we love what you're doing. It's why I wouldn't have the conversation with you. Your purpose shines through from your story and from your experience, and you've really turned what you've gone through into something beautiful. So it's been brilliant to sit down and speak to you properly. And thank you so much for joining us.
Coming on.
Really appreciate your time.
Thank you. You take care.
Thanks, Alison. Speak soon. Bye.
All right. Bye.